The following segment is sponsored by Intermountain Health. Did you know that heart disease is the leading cause of death for women? Dr. Lana McGill is an Intermountain Health internal medicine physician and Assistant Chief Medical Officer of Intermountain Medical Center in Murray. She is here to share how you can take steps now to lower your risk. Doctor, welcome to the show.
Thank you so much for having me. It's a pleasure to be here today.
We are so excited to have you. This topic is so important and so timely. February is American Heart Month. Talk to us about what Intermountain Health is doing to educate the public about heart health.
Yes, thank you so much. So at Intermountain Health, during the month of February, we partner with the American Heart Association to really raise awareness specifically for heart disease in women, as it is the leading cause of death for both men and women. It's generally thought of as a man's disease. And so we really want women to understand that this is their highest risk of mortality.
Right.
And also there are a lot of steps that we can take to prevent this disease, even if the genetic makeup that you're born with doesn't favor you in that space.
No, it's so important to get that education out there. Okay, Intermountain Health takes care of a number of patients with heart attacks. Talk to me more about that.
Yes, so at Intermountain Medical Center, which is where I work clinically, a lot of the diseases that I take care of are heart attacks and heart failures.
Okay.
And so what I'd really like the public to understand is that the symptoms of a heart attack can be different depending on your gender. So typically we think of the signs and symptoms of a heart attack of this crushing elephant on your chest type of pain, which is very common in men. It can occur in women, but the symptoms of a heart attack may be more subtle in a woman compared to a man. So you may have fatigue or palpitation, shoulder pain, jaw pain, back pain that are a little bit easier to ignore, especially for our women. You know, women spend a ton of time taking care of everybody else in their life, prioritizing everybody else and ignoring our own health often. And so really during February, we want to take time for our women specifically to understand what are my risk factors, how can I modify them, and if I'm feeling symptoms, could this be a heart attack?
Okay, so really quick, tell me, you mentioned risk factors. What are some of these risk factors?
Yes, so again, obviously part of your genetic makeup is intertwined in your risk factors for heart disease and stroke. But there are things that you can do and manage to decrease your risk. So if you have high blood pressure, understanding that is a part of your makeup, and then really working with your healthcare provider to lower your blood pressure and get it back in that normal range. Obesity is another really common risk factor in our community, and so working with your primary care physician, primary care provider to get your weight into a normal range. Monitor your blood sugar if it's high. If you have pre-diabetes, that sets you up for increased risk of heart disease moving forward.
There you go. And then for more information, you can check out the website at the bottom of the screen. Doctor, thank you so much for coming in and talking to us about this. We've appreciated it.
Thank you so much for having me. Appreciate it.